Good afternoon and welcome to Keys to Keeping Compliant, Reducing Risk, and Protecting Patient Privacy, a Health System CIO Media Inc. production sponsored by Protenus. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the editor-in-chief of Health System CIO, and I'll be your moderator today. We're looking forward to your participation. You can send in your questions or comments at any time in the Q&A box, and we'll take those later in the program. Just so you see how we're going to spend our time today, first we're going to go about 35-40 minutes with our main panel discussion featuring Jim Brady, VP, Information Security and Infrastructure and CISO at Fairview Health Services, Krista Fink, Privacy Officer and System Director for Information Privacy and Investigations with Fairview Health Services, and Nick Culbertson, CEO with Protenus. And then we will have our audience Q&A. So let's jump right in. Jim, let's start with you. Can you give us an overview of your organization and your role?
All right. Thank you, Anthony, and welcome everybody. Krista and I are in the same organization, so I'll leave a little bit for her to share about our organization. I'm the VP of Infrastructure, Operations, Vendor Management, and Cybersecurity. I'm also Chief Information Security Officer. I've been at Fairview for about 2 years and excited to be in the role. Fairview is a health system. We recently merged with a couple of years ago with Health East system. So we're kind of now 2 combined systems. And we have a partnership with the University of Minnesota Med School as well as the University of Minnesota Physician Group. So we're a fully integrated health system and also an academic health system. About 34,000 employees. We've got a large specialty pharmacy business, about 50 plus clinics. I'll leave the rest for Krista. You can fill in those. But anyway, excited to be here and talk about the topic today. So thank you.
Very good, Jim. Thank you. Krista?
Hi, I'm Krista Fink. I'm the System Director for Information Privacy and Investigations and the HIPAA Privacy Officer at Fairview. So my role is primarily legal and compliance. So I report into the compliance office at Fairview. There's different ways of structuring a privacy program, but we work closely with compliance. And in my role, we develop HIPAA compliance policies, procedures, rules, and we implement all the aspects of the HIPAA privacy rule. In healthcare, of course, that it involves sort of all aspects of the operation. And so we work with teams across the organization, like Jim said, in our academic health center, our 10 hospitals and specialty clinics and primary care clinics, as well as other lines of business like pharmacy, home care, hospice, post-acute, senior housing, and a variety of other things. So multi-specialty healthcare system. Within, Jim mentioned we have 35,000 employees. We were running the numbers in anticipation of this presentation, and we have, over 100,000 EMR users, which is relevant for our conversation today. And the volume of records that we have, 6.5 million patient records. So we're dealing with high volume data and a high number of users.
Very good, Krista. Thank you. Nick?
Hey everyone, Nick Culbertson, CEO of Protenus. We're bringing AI and automation to hospital compliance. We're a Baltimore-based company that works with over 1,000 hospitals to help our customers leverage artificial intelligence to increasing audit capability while using less resources to be able to complete those audits. And I'd say one of my favorite things about my job is being able to talk to people like Krista and Jim about their work and being able to automate steps and ultimately reduce risk for the organization.
All right, very good. First question, Krista, we're going to start with you. What laws and or regulations must health systems adhere to when it comes to accessing of electronic patient records? Who has the right to access what and when? Are there entities that audit health system EMRs looking for improper access? Or is this something health systems should or must do for themselves talk about any outside penalties that may be levied for improper EMR access. So setting the stage here to give an understanding of what people need to do and who's enforcing these things.
Right. Well, we can't talk about health systems and healthcare delivery without talking about HIPAA. HIPAA would be the main rule that kind of sets the framework for how you can use and disclose protected health information. And the HIPAA security rule includes a specific provision that health systems must develop policies and procedures regarding access to those records. But of course, HIPAA doesn't cover everything, or doesn't prescribe everything you need to do in order to accomplish that sort of privacy and confidentiality standard. So we look to other laws, and I think every state has a variety of laws governing different types of data. So it might be, the type of data you're collecting. Is it social security numbers? Is it credit card data and corresponding laws? Or it could be other federal rules like substance use disorder treatment records. They all have a confidentiality provision and sort of rules around how you can access, use, and disclose that information depending on its classification. What we're seeing in, across the nation are more privacy and security standards. So maybe Jim can speak to this, but with NIST 853 or high trust, we're using a framework for security and privacy that spans across the variety of laws that could apply. And that is where you might find more enhanced instruction around access control. Only authorized users may access PHI or other data types. When can you access? It has to be part of your job duties and within scope of your role. So aligning access to those job functions. And then, what do you do when it doesn't happen correctly is kind of the next step. So the penalties can be significant. You'll see in the HHS Office for Civil Rights, who enforces HIPAA, their press room every couple of weeks has a new release about entities that have been subject to enforcement activities. It can be monetary penalties, and you can even see criminal penalties for HIPAA violations. And then, of course, we're seeing a lot of class action litigation around privacy breaches and cybersecurity incidents, just based on a general negligence theory. So the penalties can be very steep, both for the organization and the individual who has the access keys.
So Krista, you said a lot of this stuff is state-based, some of these regulations. So when you are a multi-state health system, that can be challenging? Extremely.
And with all the M&A activity that happens in healthcare, you really want to think about those various state privacy laws. And in Minnesota, for example, kids under 18 may seek confidential services for sexual health, reproductive health, chemical dependency, and related conditions. So we have special privacy protections for minors seeking specific types of services, while our neighbor Wisconsin has similar but different rules. So you must be between or over age 14 to seek substance use disorder treatment or something like that. So there might be age-based distinctions, there might be data type or treatment type distinctions that vary from state to state. And then we have states like California and Virginia and Colorado that have more comprehensive, consumer privacy legislation that you also want to take into account as you're dealing with your, business operations, because it spans more than just delivery of healthcare to a patient.
Very good. Nick, your thoughts?
I think it's important to think about the entire scope here as well, especially with the integration of hospital systems like the M&A that you mentioned. HIPAA doesn't only apply to covered entities, but also business associates. My organization, myself, is a business associate. And the communication between covered entities and business associates is really important. It's not covered entities aren't only supposed to make sure that they're adhering to the HIPAA regulations, but also making sure that they're partnering with organizations that are sticking to those guidelines. And so vendor assessments and approval process, I think, is a really key part to this picture.
Okay.
And if I could just add,
go ahead, Jim.
Yeah, to the point of the business associates, I think the statistic is about 40% of all breaches, reportable breaches, are from, involve a business associate. So certainly in a very complex integrated health system like Fairview, we're going to be, or mHealth Fairview, we're going to have, a lot of business associates. So we've recently stood up a third-party risk management platform, which helps us, better work with the various business associates. So right now it's a challenge because everybody's busy, and if a vendor has to fill out a form attesting to, are you compliant with this, that, and the other, oftentimes it's a struggle to get the information. It's very difficult on the healthcare provider side because we don't have the staff to chase them down, and to do it on an annual basis or not even counting real time, it's a bit impractical. So these platforms, it's great because a vendor can just give their attest to their to whatever the risk or privacy or security requirements are, and they can turn that into the platform, and then the healthcare providers can who have access to that platform. And the one we're using is about 7,000 or 8,000 vendors participating in it. We can just go ahead and use that same attestation. So that not only does that save us time, but it also gives gives us the ability to be more real time. And if there was something like they had a breach or something like that on the BA side, we would be updated and notified. So I think there's advancements that are happening in the risk management, risk reduction, that will help us, minimize the number of breaches and fines and penalties that we're going to get because we're working closer with our business associates.
So these are third-party entities or organizations that certify different vendors. They'll provide a sort of a stamp of approval, and that saves you time in terms of vetting that vendor's security posture and bringing them on board as a tool that you're going to use, correct?
Yeah, I mean, it isn't a certification per se. You don't get a badge or a gold star, but the business associate will complete the survey, answer the questions, and then it's there for the other health systems in our case to have access to, and then we can go ahead and tweak it and ask more questions, verify things that we might be concerned about. But it does save a ton of time and a lot of redundancy, and makes things a lot more efficient. And so it makes it more practical to ensure that the proper controls, privacy controls, security controls are in place with the business associates. Whereas, up to this point, it's pretty difficult to try to get any, we don't have the staff to run all those folks down.
Very good. All right. Next question, Jim, we're going to stick with you. Beyond industry regulations, talk about the policies individual health systems may have when it comes to accessing patient EMRs. Do these often go beyond and are more restrictive than industry regs? How are such policies promulgated, and what's the role of IT in this process?
Okay, well, I think it's a joint effort. We have policies that are at the organizational level with our compliance department, the privacy, IT. We have IT security policies. And then we do obviously look to HIPAA, but then we're going to work closely with our electronic health record vendors. They have recommendations on procedures on how to apply certain standards, such as what vulnerabilities from a security perspective, what vulnerabilities do we need to be on top of. As far as the EHR system itself, which servers need to be in what's called the DMZ, or the demilitarized zone, not to get too technical here, but so that's basically a separate place on the network that we can expose servers, for any patients, et cetera, to access. So we get a lot of guidance from our EHR vendors. And then also important is we do an annual external third-party risk assessment every year. So that one is going to look at the the HIPAA security rule in this case, and it will, very fine-tooth comb, look and see, are we following, do we have the proper policies and procedures? If we don't have it, then it'll be noted. So that's actually very helpful. And then it will look at, what controls do we have in place? And they're looking more from a lens of, do you have this implemented, either the policy or the controls based on the regulations? And then is it fully implemented? So if it's partially implemented, you don't really get partial credit. So you either get a check, a green check, you're doing well, or a red X, meaning that you don't have it fully implemented. And so then, of course, organizations will have to, come up with a risk remediation plan. So in the event of a reportable data breach, OCR will come in and they'll want to see, well, let's see your annual risk assessment. Ideally, it should be, a continuous risk assessment. And then they'll also want to know what were the gaps, and then what is your plan to address the gaps, and what is the progress, and can you demonstrate that? Can you provide documentation for that? So then from there, they will look at that as, is there any negligence on the part of the organization? And that's where you see fines and things. So I think that's where we get into a bit of trouble, is we don't actually we don't consistently document what we're doing, and then we don't have a line. So so that's a.
Yeah, and we are more and more reliant on systems and sort of technical controls all the time in order to mature. It maybe used to be that a hospital could, you knew each other and everyone's sort of under the same roof, and only people who access the EMR are employees. Well, with the complexity of healthcare and the decentralized, nature of the way we're arranged, and many health systems are arranged, you rely on these systems for source data, like who are these employees, what are they doing? If they're not an employee, what's the right level of access do they need? If it's an external entity, what authority do they have to access the record? So is it our business associate? Is it an independent clinic partner who we're exchanging medical records with for care coordination? So there are many different pathways in how do you implement, and we are more and more reliant on the technology in order to identify the users, develop the roles, and implement the policies and procedures that we've set.
Very good, Nick.
I think when it comes to adhering to those policies and procedures, this is a great opportunity for AI to help amplify the work. Any workflow that can be manually done can be automated at a higher scale using artificial intelligence, but you can't scale those policies and procedures if you don't have them clearly defined at a manual level. And so I think the work that Krista and Jim were just talking about is so important. Every organization needs to set their own policies and procedures and incorporate it into NIST guidelines, HIPAA, and everything else. But if they're not set correctly and you try to take an advantage of an artificial intelligence tool to scale those procedures, it can identify lots of confusing aspects for the care providers, and privacy and compliance and security officials never want to get in the way of providing direct patient care. So again, I just want to reinforce that making sure that you have clear controls, security policies, and guidelines on what's going to happen when one of those policies is not followed is really important before using any kind of technology to scale those workflows.
And Nick, go ahead, Jim.
Yeah, I was going to add to that. So I think it's exciting that we have the ability to use behavioral analysis and prediction and artificial intelligence, to get in front of things that just are simply too difficult to do manually. So I think for years we struggled with, trying to at least come up with the bare minimum of compliance when it comes to ensuring that, our patient data is protected, that we have their trust. I think there's lots of surveys that say the number one trusted profession is nurses. I think providers are, right there behind them. So people value, their healthcare provider. They want to trust, their doctors and nurses, et cetera. But if we are not able to demonstrate that we can protect their data, that's a bit of a problem. So I think having the technology that can help us do what ultimately our patients want done, that's really an awesome thing. So it helps us just in order to be successful.
Yeah, I can't stress that enough, the patient trust component, and getting to that policy level is not easy. As Nick said, you really have to implement, like, bring it in and just have those discussions around enterprise risk. What are the standards? How do we want to make this happen? What are we going to do when it doesn't happen? And it's one thing to have a high level standard that says, we shall maintain confidentiality, but how you do it and what are you going to, as you work through the use cases and you apply it with your risks and you think about factors. I know I talked about, financial penalties and sort of regulatory oversight, but patient trust and loss of trust is something that is extremely significant, and it will, drive our patients away. And our employees are patients here too, and they want to know that their information is protected and really maintained confidentially as they seek services for a variety of things. So, that's not easy to quantify, but it is a risk factor that we take into account when we're developing our policies and engaging in the enforcement of those policies.
So Nick mentioned that, the first step here is developing the policies. You can't lay technology on top of bad policies, right, Nick? So talk to me about, when you've gone into prospective customers' health systems, it sounds like you have seen environments that you say, there needs to be work done here before our tool is going to be helpful. And can you talk a little bit more about that dynamic and some of the things you've seen when you go into health systems that you say, this is not mature enough here?
Yeah, of course. I think it really depends on the type of electronic medical record system you're using and what kind of security policies you have in place. One of the earliest benefits we see to using a tool like ours is not only is it going to identify people who are questionably accessing records, but it's also going to unsurface more systemic errors or issues. And one really good example is break the glass. Lots of medical record systems have a break the glass function, but it depends on how it's set up and what types of individuals are required to break the glass. Frequently, when you get a report for all the individuals that break the glass, it tends to be students or individuals that are doing consults from across the organization that don't meet the rule or criteria for break the glass, but are trying to access records appropriately. And so by adjusting a security group or creating a different rule for that break the glass protocol, it actually could significantly reduce the number of people who have to break the glass to actually do their job and be effective with their care. There's another number of examples like that, but I think it goes back to the saying of good data in, good data out, and being able to leverage the results to see exactly where issues are across the organization and take a step back and be strategic about the overall breadth of risk that the organization is facing, and rather than just trying to play whack-a-mole with the issues as they come up.
Yeah, and if I could just add to Nick's comment. So that's awesome, Nick. Oh, that's a great example. Another, I wouldn't say it's a side benefit, but to have an automated and intelligent ability to monitor and manage access to the electronic health record. We know that occasionally people get tempted to look at records that aren't theirs or what have you. Those seem to happen. But to staff education, just when people know that that we have controls in place that are seeing that, then that helps them be on their best behavior. Not that we need to have Big Brother, that threat, getting people to do the right thing. But people want to do the right thing. Sometimes they just, if there's no accountability and they, there's nothing there, a guardrail, then they might stray a bit. So I think it's helpful for organizations to, have this, educate the staff on this is, how this is what you can access. And we do all the things, role-based access, et cetera. But to have that and use it in training and education that helps people do the right thing at all times. And I think it improves our ability to respect and handle our patient information.
Krista, I want to talk a little bit more about developing the policies that we all said are so important as sort of a first step. Can you talk about any best practices or advice you have in how to, who needs to be brought together for these discussions, and what's the best way to make that happen efficiently? Everyone's time is so valuable.
Yeah, so I talk with a lot of privacy officers, and where do you set the bar? What do you allow for treatment of friends and family? Because I think in the privacy space, we've seen the behaviors, the why people do this, why people are looking at records that don't involve treatment, and some of them are intending to be helpful, some of them are just sort of not thinking, and others are malicious. And so understanding those behaviors, and then we have to partner very closely with human resources on that enforcement piece. This is what the policy says. How do we make this actionable from a human resources standpoint? What is the corrective action? And we look through our sort of grid of from one spectrum to the other, malicious to sort of unintentional or helpful, but cutting corners. How do we look at those behaviors and assign the appropriate corrective action so that we are complying with our discipline sanctions program? But beyond HR, we need those leaders and staff to buy into. We recently changed our access policy, not recently, it's been like 4 years now, but it was a big deal, changing the rules around, what friends and family access with permission. And so you can get into all the nuance of all the different scenarios, but it required sort of buy-in from the top. Our chief medical officer worked with physicians and said, these are our ethical standards, treatment of family members, we're not blurring these lines. And that's what it took to get a really solid policy around how we're going to enforce rules around access to EMRs. And then when it comes to external providers, we can take a lower conversation about it. Like you can only access for a very limited purpose, and you have to be able to prove that we have a patient in common, or you want to monitor according to your organization's risk, and you need that buy-in from both HR and, in our case, it was chief medical officer and the physician groups.
And Jim, when does IT, or when does someone like you get brought into these discussions around these policies, or is it later? Is it when we talk about putting tools on top of the policies that you get brought in?
Yeah, I think it's the latter. There are some policies, if they're organization-wide. I mean, we will probably have some input at the senior IT leadership involvement, and then I work really closely with Krista on the privacy side, compliance and audit and legal. So we're all very tightly integrated, and we do talk. And if there's an aspect that affects each other's area, we get involved. So obviously, we know that IT is one of the main ways we implement the controls for a lot of these policies, and we're using more and more automation and technology to help us do our job. So we're definitely involved at the high level, but as you mentioned, Anthony, when there comes time to either select a vendor platform or something, we have there's the proliferation of technology now is, we as an organization have embraced the digital future. And so we're wanting to, have all of those capabilities for our patients and staff. So we are, moving ahead pretty swiftly on that. So we definitely get involved at that point with IT policies.
All right, very good. Next question, we'll start with you, Krista. How do you prevent, and if unsuccessful, identify unauthorized EMR access?
So we use EMR tools like Break the Glass that were mentioned, but as Nick said, many of those are authorized, and it can be hard to tell on the front end, what someone's doing and why, because healthcare delivery is very complex. So there's multiple people who are providing care, registering patients, placing in beds, and doing the payment and coding and billing. So there's a lot of people who have potential authorized access. So we spend more of our time on, our prevention efforts are on training and education and outreach to our various leadership committees and presentations to our leadership. I see interest across the organization at all of our committees, in what we're doing. And so I always try to provide those case examples. This is what we're finding. These are the reasons why people are going into records they shouldn't. We do a lot of auditing on the back end as well. And that's where some of that AI technology comes in. We have something like, 978 million audit log events per month. So there's no way that I or my team can go in and look at everything to say this was useful or not, or for every break the glass, there was a justified reason that wasn't a good use of our time. And so we want, an audit tool that's occurring all the time, so people know, what the rules are and that they will be enforced. There's a high level of trust that we're protecting that information, and that secrets and services aren't getting out, because patients really do care. We talk every week with patients who, I have a friend or a family member who works there. I'm concerned that they're going to know something. I'm not ready to share my diagnosis. We talk to people individually, and we want to be able to provide that high level of confidence that your treatment is private and in accordance with the rules and the policies that we have. So the prevention, it's actually ongoing. So we train at new hire, we train throughout the year, we do a lot of outreach and newsletters and staff huddles, but we also learn from each incident. So, as the auditing occurs and as we find suspicious activity, we work with leaders and we message about it as much as we can. So in accordance with HR, but we use those as examples. Remind your teams, remind your staff that, you can't go and do this, or you must do this when you're going to enter a record, so that they know and understand. And with an academic health center, with the teaching and the learning that's happening in our ecosystem, we want to have really clear rules and partnership with the University of Minnesota Medical School, so that that understanding about how records can be used for education, how they can be used for research is very crisp.
And Jim, you mentioned an interesting dynamic that Krista also touched on, which is the very fact that you have a tool and that people know it's being used reduces the frequency of people looking, because they know someone's watching. So it kind of helps in that way too.
Yeah, it's kind of like driving down the street and you see the policeman on a motorcycle behind you, and you say, please don't flash those red lights.
Right,
but,
right.
Yeah, I think there's the non-malicious employee who's just, going somewhere where they shouldn't go, and they're just not using proper discretion and following policy. And then there's the bad actor that can get access to the EHR. And so they can get that through credential harvesting. They can get administered, if they are able to get into the environment, they can work their way laterally. But within the EMR, the patient privacy monitoring solution does do alerting, and so maybe Nick can add some comments to how that tool can really help. But otherwise, there's a lot of red flags that we're going to start seeing from a threat intelligence. So we'll look for traffic, network traffic activity. It could be what's called east to west, where somebody or something is kind of passing traffic that normally doesn't happen over the network. So it's basically sending data, and so we have solutions that are looking for that. And then we have, it's called north and south solutions. So that's where somebody is going to be sending traffic, network data out of the environment to some place on the internet. And so typically when a bad actor does gain access into an environment, they want to set up what's called a command and control center. So they're going to want to, touch bases with the mothership, so to speak, or the fathership. And so, so we have threat intelligence technology that's going to be looking for that proactively. But maybe Nick, if you have any comments on, within the EHR, obviously we need the intelligence and the alerting based on behavior that normally wouldn't happen by that user. So any comments on your end?
Yeah, I think just two comments. One, hospital workflows are extremely complicated. And again, not only can Krista and her team not be able to look at every single access log, but they're so complicated, it's even really difficult to understand which patterns of behavior are indicative of inappropriate activity or malicious intent versus appropriate treatment patterns. And so again, this is a good aspect of artificial intelligence to be able to see that big picture and tie the information together. And I've noticed those subtle patterns. The other thing that I wanted to reinforce is that HIPAA is not intuitive, especially when you're a clinician that's trained to do whatever you can to be helpful. And so sometimes that means making the assumption like, oh, I'm trying to be helpful, so I'm going to look into my family member's medical record to be helpful and help them understand their care. Well, that is technically without written authorization. That is in violation of HIPAA. And so the best way to prevent those type of human errors is education. And Krista mentioned that Fairview does a lot of education, not just when an employee starts, but throughout the year, and that continuity is important. But I want to tie this back to what Jim was talking about. A lot of the tools that we use are opportunities to provide that reinforcement training as well. If you broadcast training out to everyone, so many people are going to absorb it and retain it. But you can also target training to the individuals that are showing the early warning signs or going down a path that might lead towards greater risk for the organization. And that's another great application for AI, not just waiting for the incidents to happen, but looking for those early warning signs and saying, this is the person that may need to go to HIPAA train again, or this is the person that needs to, sit down with the privacy officer or their manager to remind them about their obligations when they're accessing PHI or PII.
All right, very good. Let's go to our next question. And we're going to start with Krista. If unauthorized EMR access occurs, how can it be stopped as quickly as possible, and what are the next steps? Describe how a post-breach investigation works, including any steps to determine if it was malicious. Talk about the difference in remediation for malicious versus non-malicious breaches, and describe any escalation of disciplinary action for repeated breaches by the same individual.
Sure. So with the tools that we have, now we see, what is that risk score and how do we assess the risk of harm? You can kind of understand the behavior, and this is where your privacy office, analysts and privacy officer comes in handy. So promotion for the privacy office, but you have these subject matter experts who know kind of what steps need to happen and who have those tie-ins to IT. So if it's something really egregious and very concerning, we can shut off access immediately. If it's something, where we're understanding the behavior, it's that helpful family member who is, not adhering to the rules, but they probably have an explanation, or there's something that just doesn't quite make sense. This is out of your usual workflow. Why did you go into this one over here when you normally do this? We can use those, we can handle those in a variety of different ways. And so it might be just direct education, or we saw this, that you did this. Can you explain yourself? Or don't do it again. Or here's your direct education. Here's the policy on what you may and may not do. And that's very effective at letting people know that we're looking but you've assessed some risk in there as well. So your privacy office has looked at it and said, okay, this is sort of what they normally do. And you're using a real subjective analysis. And HIPAA, breach assessments are very subjective. They look at things like, who's the person who did the access? Are they trained on HIPAA? Who, what's the extent of the PHI involved? And so there's, a 4-factor test that you look at to determine the severity. And the tools give you that help as well. So I think, every organization does it differently, but there's some spectrum of malicious intent, turn it off. You may even need to consult law enforcement depending on what has happened. And then there's this other behavior that we see and that the tools pick up on and that we see all the time, which is how do we train and educate people about where these boundaries are and make sure it doesn't happen again. And that can take a variety of forms. And you said, talk about the difference between malicious and non-malicious. And we do see it, we see it a lot more in the trying to be helpful or not, but when it comes to friends and family alone, it's not always helpful. Sometimes those are those personal connections that drive malicious intent. So there have been criminal sanctions. People have gone to jail for looking up their ex-spouses and bringing it to a custody dispute. Sometimes there's a financial incentive. It might involve looking at records to pass them off to your friend or a pharmaceutical rep or someone who's a motor vehicle accident attorney looking for plaintiffs. It could be any number of those things that you have a financial gain, you have a personal vendetta against someone, or it could be trying to help someone. And so we take those all into account when we're looking at what those, what the appropriate corrective action is. And for repeated breaches, there's a very low tolerance in this space, and amongst privacy field, you can't take the risks, or we can't accept the risks of allowing this to continue to occur. So knowing who the repeat offenders are and taking appropriate action for repeat offenses is something that we take very seriously, I think, across the industry.
And that's why you work very closely with HR, right?
Yes.
To come up with those policies. Very good. Jim, anything you want to add there?
Yeah, I was just going to add to the malicious type of a breach. So typically, if it's a one user type of event, then obviously we have access. Krista mentioned we can go ahead and turn their access off, but we do have through Active Directory a very layered approach to role-based access. So we've got we can we have multiple groups through the way people access it through, which is our Citrix environment. We can also, let's just say something is really bad, it's a bad actor. It's not a disgruntled employee, or it's not an individual, but let's say something is, it's larger than a breadbasket per se. Not that whatever breadbasket here applies in this case, but anyway, we have the ability by department, by if somebody's in nursing, if somebody's a physician, we can turn a site off, Epic. So we have a lot of controls that we can layer if it's going to be more than one person in the event of a ransomware attack or something like that. We'd want to be able to obviously contain first, and then minimize the spread and the damage, and then from there we could look to open things back up. So I think that's helpful. I think most healthcare systems, if they're on the if they're Epic users and they're on the Epic honor roll, then there's certain criteria that Epic recommends. So most of us are doing that. And if they're Cerner or other EHRs, there's basically similar types of models that people try to strive for. So there's and then of course, if it does look like it's a cyber event, then we'll bring in we have a third party forensics company that we'll engage with to look through the logs and audit and things of that nature, just to make sure that we haven't missed anything.
Very good. Nick, anything you want to add?
Just to tie both comments back together, Jim has a lot of controls to be able to block access or introduce sanctions, and Krista's talked about sometimes even need to get law enforcement involved. When you go to those steps, you want to make sure that the data you have is, 100% is accurate. And so it does go back to the importance of having really good confidence in your e-discovery approach to make sure the data you're looking at is that you actually know what happens. It's nothing worse than pulling someone out of direct care to have a conversation with them where then they say, no, that wasn't me. I was not working that day. And then you have to go back and actually then look again and see what you missed. With a tool like ours, one of the most interesting stories that I hear is individuals are able to go into those audit logs and see the minutia of the individual's behaviors. And typically what you can see when someone does go into record they're not supposed to is that it's between appropriate activities. And an individual will say, no, that wasn't me. I walked away from the workstation. I was doing other things. Someone stole my password. And then you show them there's no way because there was half a second between you doing this and doing something else that you were supposed to do. And you told me that you did this. And so having that ability to take the information, sit down with them, have that conversation and show them the information so that you're confident you know what happened, and essentially just walking themselves into a corner.
Good advice. Very good point. All right, next question. Krista, we're going to start with you. With staffing challenges impacting most every department within a hospital, what should compliance and IT departments do to ensure they are protecting patient privacy with limited resources?
You have to rely on your stakeholders and that sort of education piece and the knowledge. So in the example, where you walk someone in and you're showing them, you're also reminding the manager and other staff that we are tracking this and we are looking at it, and using that to your advantage so that there's just a widely held belief that everything is monitored, mm-hmm. and that you have to, that's a deterrent effect. But we rely a lot on our site liaisons or compliance liaisons across the organization to help bolster these code of conduct and compliance standards and technical standards. So if we have a rule, it needs to be known and followed by everyone. And since we're decentralized and we're not all under the same roof, you have to rely on building those controls into the workflows, helping people understand the concepts as much as they can. And from a privacy office operations standpoint, we want to make sure that we're focused on the things that really matter. So letting go, you can't look at everything. You cannot review every access or every break the glass. It's not useful. You want to focus in on those high risk opportunities that you have to educate and train and really audit. And OCR, the Office for Civil Rights, wants to see that you're engaging in ongoing risk analysis and that you know where your PHI is, you know what your risks are, and you're doing something to continuously improve and manage that. And so focusing your efforts on those high priority areas is necessary, just given the resource constraints and limited staff.
Krista, we talked about the desire or the benefit of publicizing or making known the monitoring technology is there and the effect that has of people not looking where they shouldn't be looking. Do you also want to let it be known and publicize, so to speak, the consequences for a first, second, third offense? Do you want everyone to know that as well?
Yeah, so we try different things all the time. So we used to, our HR used to say we cannot share, if anyone's been terminated, but people want that, and it is very actionable and impactful. So, with our internal compliance committees, I am very transparent about, we saw this many terminations in the last quarter due to privacy violations, and this is what happened. And I think it's very useful that people have those actual tangible use cases. I have heard, from different privacy officers, oh, you would never do that, or we always do that. And so there's, variety, I guess, but I think that transparency is helpful because it helps promote that culture of confidentiality, that culture of trust. So it's not that we're Big Brother looking, even though we're looking, it's the reason we're looking is to promote privacy and promote patient trust.
Jim, anything you want to add there?
Yeah, I think Krista nailed it. You know, I mean, even if we, I mean, we need that EHR record belongs to our patient at the end of the day, and so we need to have everybody understand that it's not about following the rules and making your job harder by a bunch of extra clicks or having to log in or this and that and the other. It's really valuing you know, our communities and our patients and respecting what they are wanting and needing. So I think that's the ultimate message that you have to, you know, we have people coming and going in the organization, so it's a constant education thing. So I don't think we can, you know, I don't think that we can say enough about that. You know, I think an automated platform to be able to help us understand what behavior is not appropriate and calling that, you know, calling that out is helpful. Even if we, like you mentioned, there are staffing challenges. Typically, that's either the organization is, you know, challenged with funding, or else we don't really have the ability to get the appropriate level of skilled staff, right? It's going to be one of those two. And even if, Anthony, you were able to give Fairview $20 billion and say you hire everybody you want, I don't know that we have enough, you know, I don't even know if you could possibly stay on top of all the, you know, every record of it that's being accessed, you know, it's just not possible. So we definitely need the technology platform to help us. But there are things that we can do as organizations to look for ways to, you know, to get more funding. We're doing some work with, you know, more automation, like what can we automate in order to save dollars? You know, so I think that's a great, just leveraging technology is something we can do to help us so that we won't be as challenged, you know, staffing wise. But, you know, with the COVID surges, et cetera, you know, a lot of us have to staff up. And so when you're bringing in temp nursings and nurses, et cetera, they're, you know, they're much more expensive. And so those are budget challenges. So we definitely have the budget challenges, but I think, you know, I think we just need to work together and use technology to try to get to the end state that we're looking for.
Nick, anything you want to add?
Well, Jim covered everything I would have said about the advantage of artificial intelligence and automation. But the only thing I would add is often when I talk to customers during the challenging times that the pandemic has brought, I encourage to consider looking at the actual policies that they have in place too, because artificial intelligence can help automate a lot of workflows, but sometimes a tweak to policies can actually help open up that automation even further. And I'll give you an example. A lot of organizations have a hard and fast rule that if you look up any family member, you know, be it benevolent or malicious, that is a termination event, and there will be consequences. We also know the nursing shortage and staffing is really difficult for hospitals right now. And so if you're coming to HR and saying, I have all of these people I need to terminate, that's just not an ideal situation. And so, you know, one technique to consider is to say, well, for first time offense, if it's benign and if it's not a malicious event, you know, you're going to get, you know, you're going to get notified, you're going to get educated or reminded, and it's a second offense that is going to be a termination event. And in a small tweak like that, we've been able to show that you can actually eliminate the volume of violations that are occurring in the long term and prevent both repeat offenses and first time offense, because you're spreading awareness, you're increasing education, and you're reminding individuals their responsibility, but you're also not putting more burden on other parts of the organization by, you know, bringing all these incidents that's just not practical to result in termination at the volume that it may be occurring.
All right, we're going to go with we don't have much time left, so we're going to go with a lightning round of last thoughts, and I will give you a little framing for each one of you. Jim, for your CISO colleagues, best piece of advice on this topic?
Yeah, I would say for those that are not heavily involved with privacy and compliance, and this is a great opportunity to you know, understand that part of the organization. So partner closely with your compliance, legal, audit, and the medical groups. So just to be able to give you better context and really understand what the strategic imperatives are and how we can work together to improve our patient privacy. Thank you.
Krista, your framing is, I'd like you to speak to your fellow chief privacy officers about working with CIOs and CISOs.
Yes, well, you can't do it alone. So HIPAA used to be very much in the legal, regulatory policies, procedures, drafting and committees and approvals. It's just very much moved into the technology, actually how you implement. You have to partner very closely with CISOs and CIOs to understand how your EMR even works, what are people doing in it, and then how can you build privacy into those workflows and things, and just understanding that data has to move from outside your walls, or that is the way it is now, and you can't just treat a patient with a paper medical record and then move on with your day. That information has to be shared, and you want to make sure you shore up all those controls so that privacy is protected along the way, and you've mitigated your regulatory and legal risk and reputational risk.
Very good. So Nick, your framing is this: folks like Krista generate this interest in a health system. They bring it over to folks like Jim, who then hit the market and have to figure out what tool they may want to buy for this. What's your best advice to those who are going to go shopping?
My best advice is, I think a lot of the vendors, if you walk around HIMSS or other trade shows, a lot of them talk about using artificial intelligence. And I think you need to be very studious and to discern what they mean when they say that. I've seen other vendors say AI and they mean automated intelligence, which I think all software is automated intelligence. And so asking the right questions of a vendor, when you see artificial intelligence, what do you mean? What goes into your artificial intelligence? How can we trust it? Is it black box? Like what are the features you? What's the training data that's been used? Can I talk to your data science team? I think those things are really important, because this ultimately comes back to trust. And with privacy, if you can't trust your data and if you can't trust the results that are coming out of it, we're talking about patients' information and their well-being. And so it's really important that that trust occurs from end to end.
Excellent. Well, that's about all we had time for today regarding continuing education. You can use the final slide in this deck for your CEUs. You'll get an email when the on-demand recording is ready for viewing. If you want to sponsor an event with us, you can reach out to Nancy Wilcox from our team and go to our website to register for upcoming webinars. With that, I want to thank our panel. Tremendous conversation today. Jim Brady, Krista Fink, and Nick Culbertson. I want to thank Protenus for making this event possible, and you, our attendees, for coming. And with that, everybody have a wonderful day. Thank you.
Thank you.